Hello guys, Vanakkam and welcome to Meteor Nursing Academy, one of the leading academy in training nurses in their nursing competitive exam as well as IELTS and OET training. Today we are going to discuss about Jipmer question paper solution, that is part 4. Already part 1, part 2 and part 3 is there in Meteor Nursing Academy YouTube channel. I will be giving the link in the description, kindly check it out. And today we are going to discuss about part 4. Please watch the video till the end. If you like the video, please like it, share it, subscribe it, and don't forget to click on the bell icon. Let's begin the session. Which one is the shockable rhythm? And they have given 4 options: VT with pulse, systolic, pulseless VT, junctional rhythm. What is the meaning of shockable rhythm? See, shockable rhythm means here we are going to use the defibrillator. We are going to use what? Defibrillator. In order to restart the heart is functioning abnormally and we are going to restart the heart by means of using a machine called as defibrillator, and it will give a shock to the heart and it will restart the heart. This is called as what? Shockable rhythm. So in which condition we supposed to use this shockable rhythm? And 4 options they have given here, that is VT with pulse and pulseless VT, systolic and junctional rhythm. Among these 4, which is the right answer? Let's see. What is VT with pulse? Here ventricular tachycardia is taking place. Ventricular tachycardia, and the pulse is also present. It means you can see this is the heart, okay, and the ventricles are pumping very fastly, and obviously filling of blood is present. What is present? Filling of blood is present. There is a time for filling of blood in the ventricles, and the blood is pumping out of the heart through all the body parts, through the blood vessels. So what is present? Pulse is present. Okay, so in this condition there is no need for shockable rhythm. And the next one is systolic. There is no disease condition called as systolic. In order to confuse you, they have given this option. Okay, and the next one is pulseless ventricular tachycardia. So what is the indication of shockable rhythm? There are 2 indications for the shockable rhythm. The first one is ventricular fibrillation and second one is pulseless ventricular tachycardia. Why in these 2 rhythm we are giving the shockable or shock? Because in ventricular fibrillation as well as in pulseless ventricular tachycardia, what will happen? There is no time for refilling of the blood. There is no time for refilling of the blood in the ventricles. Why? Because the heart, especially the ventricles, are pumping in very rapid. There is no rhythm. It is pumping very rapidly, so it is not giving time for the blood to fill in the ventricles, so no outflow or output of the blood. There is no cardiac output. So if there is no cardiac output, how the pulse will present? There will not be any pulse. So in these 2 conditions, this ventricular fibrillation and ventricular tachycardia, what we supposed to do? That which ventricular tachycardia? Pulseless ventricular tachycardia. What we supposed to do? We supposed to use the defibrillator to administer the shock and the heart will restart again. Okay, so here which is the right answer? Pulseless ventricular tachycardia is the right answer. Again, we can see in detail. Okay, fine. Now we are going to discuss about other 2 options also. See, ventricular fibrillation, here it is clearly mentioned, heart rate is chios. What is the meaning of chios? You can see the abnormal heart rate. What is the normal ECG rhythm? You can see P, Q, R, S, T. This is the normal ECG rhythm. Whereas here, the rhythm is chios. There is no proper rhythm. There is no proper P waves, QRS waves, T waves. Okay, so this condition is called as what? Ventricular fibrillation. Next one, ventricular tachycardia. You can see the regular QRS is present, okay, and it is in tachy. Usually how to identify the tachycardia in ECG? In between 2 R waves, 4 box as to present. Okay, how many box has to present? 4 box. But here you can see in between two R waves there are only half box, not even one box, only half box you can see. Understand? So this condition is called as what? Ventricular tachycardia. Here heart rate or heart rhythm is very fast. Okay, in these two situations what we can do? We can do the shockable rhythm. There is a need for defibrillation. And the second thing is pulseless electrical activity and asystole. Why I added this content? This is coming under what? Non-shockable rhythm. Non-shockable rhythm. So what is that non-shockable rhythm? Even if you are giving defibrillation, there is no use at all. That is called as what? Non-shockable rhythm. In which two disease condition we can use there is no need for defibrillation? That is pulseless electrical activity, asystole. See, the beauty of the pulseless electrical activity is here the electrical signals can look like normal. What is the meaning of electrical signal? This is the heart and this is the SA node and this is the AV node. From the SA node, that is the pacemaker of the heart, the electrical impulse will carry to the AV node. From the AV node, bundle of his, from the bundle of his right and left bundle branch, and from there Purkinje fiber, right? So it will go up to the apex of the heart. So this one is called as what? Normal conductive system. During this normal conductive system, how the ECG waves is going to be? There is a proper P, Q or S and T wave. Okay, so the same ECG rhythm will be present in the pulseless electrical activity also. Normal sinus rhythm image you can see in the ECG, but there is no blood flow. Underline the word no blood flow. Okay, so in this condition, if you are giving ECG, no use at all. Even though the ECG is showing the normal sinus rhythm, the heart is not contracting, there is no blood flow at all, no pulse at all. It is like a dead heart. Okay, so this condition is called as pulseless electrical activity. And the next one is asystole. It is also known as what? Flat line. Here also there is no electrical activity at all, no pumping of heart, no blood flow or no cardiac output. So here there won't be any pulse. Here also there is no need for any kind of defibrillation. Understand, guys? And one more thing what we are going to see now is junctional rhythm. What is junctional rhythm? You can see in this image. See, junctional rhythm, before understanding about that, we should know about the different area of the conduction. If SA node, one sec. If SA node is conducting the electrical impulse, how the SA node will conduct? It will conduct from SA node to AV node, from AV node to bundle of his, from bundle of his to right and left branch, and from here Purkinje fiber. This is how the electrical activity will conduct, right? If the SA node is conducting the electrical activity, the normal heart rate is 60 to 100 beats per minute. We are discussing about the normal one. Okay, suppose if the SA node is not at all working, there is some problem with the SA node, and the responsibility will be taken by the AV node. The AV node will function independently. Underline the word independently. If the SA node is not working, the AV node will function independently. In this time, the heart rate is going to be 40 to 60 beats per minute. 40 to 60 beats per minute. Okay, and this condition is called as what? Junctional rhythm. This condition is called as what? Junctional rhythm. Fine. Okay, one more thing. If SA node is also not working, AV node is also not working, then what will happen to the heart? Here now the bundle of is will function independently. Even though the SA node is not working, AV node is not working, but still the bundle of is will function independently and the heart rate is going to be 40 to 60 beats per minute. If SA node, AV node and bundle of S3 are not working, this time the left and right bundle branch will take the responsibility and it will function independently. This time the heart rate is going to be 20 to 40 beats per minute. If all these four is not working, at last the Purkinje fibers function independently and it will give up to 20 to 40 beats per minute the heart rate. So this is the normal physiology of the conduction of the heart. So here the fourth option is junctional rhythm. Junctional rhythm means what? If SA node is not working, AV node will take the responsibility and it will function independently. This type is called as what? Junctional rhythm. And in ECG, what changes will be there in case of junctional rhythm? This is also very important for your exams. Two changes will be there. That is inverted P wave. The P wave, this is the P wave. The P wave is going to be inverted. This P wave is going to be inverted. Or there won't be any P wave at all. There is no P wave at all. So if these two variations or changes is present in the ECG, means it shows it is in the heart is in functional rhythm. On the whole, which is the right answer here? The shockable rhythm is applicable for ventricular fibrillation and pulseless ventricular tachycardia. And here pulseless ventricular tachycardia is the option given. So we have to select the pulseless ventricular tachycardia. Mirror therapy is used for. Four option given here: accident patient, OCD, that is obsessive compulsive disorder, C phantom limb, D mental disorder. In order to solve the question, you should know what is the meaning of mirror therapy. See, mirror therapy is a therapy which is used to trick the brain. What is that tricking the brain? Let's see. First, let's see the answer. Mirror therapy is used for what? Phantom limb. What is phantom limb? Amputated limb. In this image, you can see very clearly the person is having a amputated limb. Okay. Here you can see the amputated limb. Okay. And in the center of the two legs, this is the first leg and this is the second leg. In the center of the two legs, here you can see the mirror. And the person is looking into the mirror. Okay. And when he look into the mirror, he can see the image like this. Okay, actually this person is having right leg amputated. Which leg amputated? Right leg is amputated. But while he looking into the mirror, it looks like right leg is present for the patient. It looks like what? Right leg is present for the patient. It is nothing but here we are tricking the brain. It gives an illusion that missing limb is present and the missing limb is moving. Okay, so this is the idea behind that. It reduces the stress, depression and pain of the patient and the patient will feel happy. So this type of therapy is commonly used in where? Phantom limb. Mirror therapy is used for what? Phantom limb. Which among the following is the treatment of hypertensive crisis? Levosalbutamol, labetalol, potassium chloride, sodium citrate. Again, to solve this question, you should know what is hypertensive crisis. It is an emergency situation. The hypertensive crisis is also called as hypertensive urgency or hypertensive emergency. Hypertensive emergency. So what will happen in this hypertensive crisis? It is a life-threatening condition where the blood pressure is peaking up to 180/120 mm of Hg. Okay, more than or equal to 180/120 mm of Hg. That is mercury, which leads to what? Organ failure. So this condition is called as hypertensive crisis. See, organ failure in the sense the person will go for what? Hypertensive encephalopathy, retinal hemorrhage, papillary edema, acute renal failure. Fine guys. So what is the right answer here? And the right answer here is option B, that is labetalol. Why we selected option B as a right one? Let's see the option one by one. Let's see the rationale one by one. The first one is levosalbutamol. What is that? It is a beta 2 adrenergic receptor agonist. Beta 2 adrenergic receptor agonist. Okay, and what is the function of this? It is commonly used for COPD patient and asthma patient, and it is nowhere related to hypertensive crisis. So we can remove option A. And the second option is labetalol. As you all know, it is a beta blocker. So it is used for treating what? Blood pressure, high blood pressure. So this is the right answer. And whereas C, that is potassium chloride, which is used to correct the potassium level in the body. Correct the potassium level in the body. And the last one is sodium citrate. Sodium citrate, it is used as an anticoagulant in the old blood, as we all know. And it is also used for urine alkalinization. Urine alkalinization. Okay, and also used for the prevention of nephrolithiasis. What is the meaning of nephrolithiasis? That is kidney stones. It prevents the formation of kidney stones. Okay, so these are all the rationale behind each and every option. And which option is directly applicable for this hypertensive crisis? That is labetalol. That's why we selected option B. Which laboratory value indicates infectious process? It is not I indicates, it is indicates. And 4 option given here: platelet count 4 lakhs, WBC count 15,000 by millimeter cube, HB count 11 grams, neutrophil 55 to 70%. It is a memory based question, and you should know the normal value of each and everything in order to solve this question. Even though it is a simple question, many students are making mistake in this. Okay, so let's see in detail. First, you should know what is the meaning of infectious process. Infectious process in the sense the person is having some infection because of bacteria, virus or fungi, whatever it is. In that situation, which value will increase? So what is the normal platelet count? The normal platelet count is 1,50,000 to 4,50,000. Okay, and it is measured in milliliter of blood. Okay, so this value is coming under the normal one. So just remove this first option. And second option is WBC count is 15,000 by millimeter cube. So what is the normal WBC count? It is 4,000 to 11,000. Right. So here the value which is given in the option B, it is more than 11,000, and during infectious process obviously the WBC level is going to get increased. So option B is the right one. And what is the next option? That is HB count 11 grams. As you all know, for females it is 12 to 16, and for male it is 13 to 17 or 17.5. It varies according to the book. Okay, and here the HB count is 11 grams, that is in borderline, but still it is nowhere related to the infectious process. So we can remove the option C. And the last one is neutrophil, that is 55 to 70% they have given here, and the normal neutrophil level is 40% to 60%. Okay, usually during infectious process the neutrophil count has to be elevated highly, but again here it is in the borderline. Okay, so we can remove this option also. So at last, which option is applicable directly to the infectious process? That is highly elevated WBC count. So option B is the right one. Which tube is used for intestinal decompression? 4 options given here: NG tube, flattest tube, Sengstaken Blackmore tube, Miller-Abbott tube. In order to solve this question, you should have the idea about the intestinal decompression. What is that? It is nothing but in case of any extended or distended colon, you are going to use a tube. It will release the distension of the colon. So what tube we are going to use? We are going to use some tube, that is the answer. So let's see the rationale behind each and every answer or options, so that we can come to a conclusion of a correct answer. The NG tube. As you all know, the NG tube, it is used for feeding or giving drugs and to remove the substance from the stomach by means of aspirating the stomach contents. Okay, fine. So it is not going to be decompress the intestine. So we can remove the option A. And the next one is flattest tube. Some of the important golden points are there for the flattest tube. I'm going to explain it. Please listen carefully. The first point is the colon Flattest tube is also called as colon tube. Okay, and also called as rectal tube, colon tube or rectal tube. And the second golden point here is it is used in the treatment of volvulus and intersusception. What is this volvulus and intersusception? These two are intestinal obstruction. Intersusception means binocularing of the intestine, and volvulus means twisting of the intestine. And the next golden point here is it has to be inserted 4 to 6 inches only, and it has to be inserted in the anal region. How many inches we have to insert? 4 to 6 inches only. And next golden point is you should not keep this tube more than 20 minutes. You should not keep this tube more than 20 minutes in the anal region. If you are keeping this for more than 20 minutes, it will cause what? Anal sphincter muscle damage. So remove the tube before 20 minutes. So one more important point, which tube is used during the barium enema? During the barium enema, that is flattest tube is used during the barium enema. So these are all the golden points you are supposed to remember related to flattest tube. The next one is Sengstaken Blackmore tube. This is the tube which is used for compressing the esophageal varices and reducing the intestinal bleeding. So you all know esophageal varices, it is the complication of cirrhosis of liver. During cirrhosis of liver, what will happen? Esophageal varices will take place. Varices is nothing but dilatation of the blood vessels. Where? In the esophageal region. So what we supposed to do? How to reduce this bleeding? The option here is Sengstaken Blackmore tube. Okay, and the last one is Miller-Abbott tube. It is the right answer. Why Miller-Abbott tube? It is used for what? Intestinal decompression. It is used in the treatment of obstruction in the small intestine. Okay, so this is the right answer. Let's see the images. See, the first one is the Sengstaken Blackmore tube. Here in Sengstaken Blackmore tube, you can see two balloons. One is present in the esophageal region, that is near to the cardiac sphincter. This area is called as sphincter, cardiac sphincter. Okay, so near to that one balloon is present, and second balloon it is present in the stomach. Okay, this balloon will give compression over the dilated blood vessels and it will reduce the bleeding. So this one is the Sengstaken Blackmore tube, and the next one is flattest tube. The second one is flattest tube. There are different French sizes available in the flattest tube. Okay, it is also called as what? Colon or rectal tube. And the third one is Miller-Abbott tube. Here two lumens is present here. This is the external part and this is the internal part. This internal part will go inside the intestinal system. Okay, fine. These two lumens, one lumen is for inserting the mercury and second lumen it is for irrigation and drainage. Okay, so what is the use of the mercury? Through the mercury is used for weight, increasing the weight, and the mercury will be filled in this balloon, filled mercury area. And because of the weight, it will go inside the intestine very easily and it will be present in that area for a prolonged period of time till the irrigation and drainage is getting over. Okay, so once the irrigation and drainage is over, the decompression will take place. Okay, fine. So it is a double lumen tube in order to drain and decompress the small intestine. Fine. So this is all about the Miller-Abbott tube. The next direct question is, which position is used in abdominal examination? For abdominal examination, the position is supine with leg flexed. To give the more clarification about the intestinal organ, the person has to flex the leg and the person has to lie in the supine position. How many cycles need to complete CPR switching? And in order to solve this question, obviously you should know what is the meaning of CPR switching. Example, two rescuer is handling the victim. Victim means patient. One rescuer is giving the CPR, that is compression in the heart. Another rescuer is handling the airway. After how many cycles of chest compression, the first rescuer has to change, because the rescuer would have become tired, fatigue. He cannot give the CPR, chest compression, for further period of time. He has to change. That changing is called as what? Switching. Okay. So after how many cycles the person who is giving chest compression has to change? And here the right answer is option D, that is after 5 cycles the CPR switching has to take place. Okay. So let's see the golden points which is related to CPR. The first one is, what is the ratio of giving CPR? For adult, there are many changes happen after 2014. New protocols are there. According to new protocol, we are going to see this. Okay. For adult, what is the chest compression to mouth breathing ratio or respiration ratio? See, for adult, it is 30:2. Whether it is a single rescuer or double rescuer, whatever it is, for both the thing, for single rescuer and double rescuer, the only ratio is 30:2. That is 30 chest compression and 2 airway. And the next one is for children's. Not only for children's, for neonate, for children or for infant, whatever it is. In case of one rescuer, the ratio is going to be 30:2, and for two rescuer, the ratio is going to be 15:2. Fine. Okay. And one more important golden point, that is to where we have to concentrate. Previously, always we used to say it as A, B, C. First we have to clear the airway, then we have to check the breathing, and last we have to go for what? Circulation. But now, as per the new protocol, it is totally changed. Here we are going to concentrate on CAB. First we are going to concentrate on circulation, followed by that airway and breathing. This is the right one according to new protocol. What is the reason behind that? See, the brain death, it will happen within 10 to 15 minutes. Okay, so how to prevent this brain death? That's why they have changed the ABC to CAB. What is the rationale behind this? See, this is the heart. Even if the heart stopped or cardiac arrest taken place, some amount of blood will be present in the heart. If you are giving compression first, what will happen? The amount of blood, little amount of blood or whatever the amount of blood which is present within the heart, you are going to compress it. So that blood is going to come out in the aorta and it will go to the brain, and it will make the brain to survive for little more longer. The brain death is prevented here. That's why we are going to give compression first. Okay, so that's why they have changed from ABC to CAB. This is the rationale behind that. So guys, hereby I am ending part 4. Already part 1, part 2, part 3, it is there in Meteor Nursing Academy YouTube channel. I will be giving the link in the description. Watch it out. If you like this video, please like it, share it, subscribe it, and don't forget to click on the bell icon. Watch the video, understand the rationale, do the revision again and again. R and R, that is rationale and revision, is the only slogan in order to solve your questions during the exams. Read the content along with the rationale. That is very important. In one question, 4 options are there. If you are reading along with the rationale, you are reading 4 questions in one question. So that's why in Meteor Nursing Academy, we are explaining everything with the rationale. So watch the video, understand the questions, understand the rationales, and if you have any doubts, please comment us in the comment box. Thank you guys.